Hello everyone, this is Kevin Kruse here with Texas Orthopedic Associates in Dallas, Texas. We're a division of Lone Star Orthopedics. Here today talking to you about shoulder surgery and some of the reasons why we use the devices and implants that we use in shoulder surgery. So for me, I utilize two companies mainly. One is an arthroscopic bone tunneling device company called Tensor Surgical. And the way that we fixed rotator cuffs since the 1940s was actually doing an open procedure where we went in and we made a tunnel in the bone, a transosseous tunnel, and sutured the tendon to the bone. And this was actually a very good way to repair the tendon, but until recently you had to use an open method to do that. So we transitioned to the arthroscopic method, which required using anchors. But what we've developed now is tunneling systems that can be done arthroscopically. And why would you want to use bone tunnels? Well, a lot of reasons. One is that it decreases the pain from your operation. We think that by not putting anchors into the bone, you decrease the subchondral pressure. And there's actually data to support this, that making small tunnels in the bone and utilizing that as your way to fixate the tendon to bone is decreased pain. The other is actually decreased cost, right? Bone tunnels work fantastically well. By not putting a large number of anchors in your shoulder, we drive down the cost of the procedure. And in this age, we're trying to always contain the costs of the procedures we're doing while still maximizing our outcomes, right? So we're trying to get the best outcomes with the surgery we're doing. We want you to have the best outcome from your operation, but we're also trying to do it at the lowest cost possible. So I utilize a Tensor Surgical reusable bone tunneling device for a lot of my rotator cuff repairs if that operation fits that patient. I always tell everyone, I have a lot of tools in my toolbox, and I think of it as playing a golf shot. Different club for different shot, different swing every single time. It's always a unique situation. So that's one of my tools, is an arthroscopic bone tunneling device, Tensor Surgical.